Now we're going to talk about safe stations. I suspect all of you heard about it, but why don't we start with a definition so we're all on the same page. Anytime, day or night, weekends, holidays, if you're struggling with addiction issues, you can walk into any fire station in our community and you will get immediate help. That is the definition we're working on. I'm looking at my notes here. This is not a federal program. It's not a state program. This is not the brainchild of somebody from Silicon Valley. This is the brainchild of a fireman in Manchester, Chris Hickey, who was going to be here so we could give him a round of applause, but he couldn't come. So I will tell you that he saw the need. He saw how fire departments and firemen could help with this need. He began and shepherded the Safe Stations program in Manchester for now about a year. And they are over 1,200, is that right? 1,200 people have walked into their fire stations. Nashua began our program about 5 months ago. We've had 300, give or take, 351 people walk in. Hooksett opened theirs a couple of weeks ago, and I just learned tonight that Annapolis, Maryland has started a safe stations program, and I believe this is right, have given Manchester the credit. As we listen, ask yourselves these questions. Is this something that every community in our nation needs? Because if they haven't gotten the problem yet, they're going to get it. Tonight, we're going to talk primarily and hear from and ask questions of people who do the work, the people in the trenches, including the people who have walked in. But first, I would like to introduce to you the leaders of this program who really make it work and who meet once a week to make sure that the program continues to work smoothly. Our mayor, Jim Donchis, who is here. Actually, if each of you will keep standing till we've got the whole group, and then we can give one applause for everybody. Fire Chief Stephen Gallipo. I haven't seen him here.
No, he's on vacation.
But assistant,
I'm the best you got.
so the best we've got is Brian Rhodes, who is the assistant fire chief. And the director of AMR, that's our ambulance service, is Chris Stawas. And the representative from the Southern New Hampshire Medical Center, Vice President Dr. Stephanie Wolf Rosenblum. And the director of Keystone Hall, which is our facility for alcohol and drug rehabilitation, Annette Escalante, but I haven't seen her either. There she is. Okay. Thank you, Annette. And the CEO of Home Health and Hospice, I'm sorry, that's my wife's job, of Harbor Homes. Don't tell her I said that. And Partnership for Successful Living is Peter Kelleher. Now, I would say that, I'm turning my page here, this is government at its best. And now all of these different organizations in government are working together for a common cause, and they're working with a nonprofit. And this is New Hampshire at its best. Thank you very much, and please have a seat. Now, our mayor, Jim Donchis, who has shepherded this into our city and continues to support it and make it run, is going to give us a few words.
Well, first I'd like to thank David for organizing this tonight. A program that, and I'd like to thank you all for coming. Safe Stations is a program that in Nashua here we are all very proud of. We're proud of the work that people have done, the dedication that they have shown. So many people have contributed. Starting with our firefighters, and John, you're going to hear from John later. Our entire fire department from top to bottom. Brian is here representing the chief and the administration. Harbor Homes, who has done such a great job in responding to this crisis. Everybody there, it's incredible, their dedication. Our hospital, of course, AMR, our ambulance service, Chris Staywas. Everybody is doing such a good job, and you'll hear, I think, about a few of the numbers. But we, in the fall of last year, saw that ODs were escalating. We had 7 deaths in October, 7 deaths in September of 2016, 47 total ODs. Now this is a health crisis that the fire department was already responding to, in the sense that the fire department responds to every OD call and carries, now for 2 years, Narcan. So they were saving lives in that way, but we're still seeing a lot of ODs. But for some months, we've been watching the Manchester program, and Julie asked me to kind of explain how we got going. We've been watching the Manchester program, seeing that they were getting a lot of reports, and we were trying to put together the pieces that we would need, the players, the partners that we would need here in Nashua to do a similar program. Now we knew, and so we'd been talking to the fire department over a period of time, and they had gone up to Manchester and figured out what was going on, and they were getting used to the idea and thinking about how they could do this. Chris Staywas was the kind of the pioneer, because Chris knew all about what was going on in Manchester and sort of how it was working there, all the licenses we'd have to get, and a lot of other very detailed and important information. But the part that we were missing really was that we knew that if people began to report to the fire stations, that we could not tie up a fire station for hours while they waited for someone to respond. So we needed a partner who could go to a fire station, take people to a place where they could get help. And of course, that's where Harbor Homes came in. Harbor Homes was working on trying to get a grant and the funding to make their treatment array more complete. So near the end of, in the fall of, near the end of the year last year, I talked with Peter and I said, I think we have the fire department ready to go, we have AMR. Up in Manchester, they're using Serenity Place, where the people are taken up there. I had met with Serenity Place, and I said, is there any way that you could provide this back-end service, the service that would pick people up and then get them to treatment? And Peter said, I think we can if we have a month or two to get things together, which is exactly what happened. So Harbor Homes stepped up. They put together the pieces necessary. And so right now what happens is that Harbor Homes picks up every person at the fire station, and as soon as a report takes place, and does that within less than 12 minutes, and then brings them here either to the shelter, but now principally here at 44 High Street, and gets people treatment. And the group working together, but Harbor Homes is so essential to this. We have seen a significant drop. And we, of course, say our prayers, we knock on wood, whatever you want to say. We keep our fingers crossed every time we say that. We've seen a significant drop in the number of ODs, to the point where right now, Chris told me through today in April, we've had 7 ODs, but today is the 27th. Again, we had 47 in October. Now we know that with carfentanil and all these other drugs that those numbers could jump again, but we think that by working together as a community, we've been able to save lives, get people help, and I'm not one of the direct participants. I don't provide the service, but and on behalf of the community, I just feel very proud of all of the work that has been done here, the way people have gotten together to attack this problem, and I just couldn't feel better about our community as a result of everyone working together. So that's my perspective on it. I think, again, everybody's doing a fantastic job. We're looking for little ways to improve the situation, even improve the response, which I think we can develop. But I couldn't say more about everyone who's been participating and working on this so hard. So thank you all for coming. Thank you, David, for putting this together. And I look forward to hearing from a number of the people who are sort of on the front lines here and can tell us more about what's happening out in the community. So, David.
And thank you, Mayor Donchis, for your leadership. Next, Peter Kelleher, the CEO of Harbor Homes and Partnership for Successful Living, will say a few words.
Thank you, David. Good evening, everyone. Thank you so much for coming tonight and learning a little bit more about the whole Safe Station initiative. Tonight we are dedicating this evening to a beloved staff person, Lisa Milan, who passed away just recently, who has dedicated her entire career to helping people on the journey of recovery. So just wanted to remember Lisa tonight, and she was always one of these people that was so impassioned and positive, no matter what pain or stress she might be experiencing. She always had a smile on her face. And I just can't tell you, she exemplifies the kind of people that we want to have working within our partnership. And I just want to thank all of the people like her that have been working so hard in making this effort happen. From the drivers to the licensed alcohol and drug counselors that wake up in the middle of the night to make sure that this goes forward. And I want to point out that this is a partnership between both Harbor Homes and Keystone Hall. Keystone Hall is actually the oldest and largest substance abuse treatment agency in the greater Nashua area, and they have had such strong resources and staff and history in the whole recovery effort. So this can't overlook Keystone Hall in this effort. And thank you to Annette Escalante for her wonderful leadership there. The other thing I wanted to do is thank all of the partners locally that have just been so amazing in joining together. The firefighters, more than half of the firefighters in the city of Nashua have come and toured the facility here because they care about what happens to people that go on this journey. And the ambulance department, the dedication and care that we see throughout this whole process. So, and of course the mayor for incredible leadership in bringing us all together. I wanted to just take a moment and tell you a little bit more about how we see what it is that we do in the Safe Station program. We all know that people in the journey of recovery have this magic golden moment where they might say, yep, I'm ready to get some help, and now is the time. We know that the window opens for that help for a brief period. And what we've been doing in the Safe Station program is catching the window being open and making sure that we offer every possible array of services to folks as they show up at the fire station. And they quickly get an evaluation, and then there's a determination as to which one of the many different programs that might be available to people, whether it's residential or outpatient and so forth, are the right match for that person. So I want to also just say that we hope that the message that people get coming into the Safe Station is that they are treated with tremendous respect, and that oftentimes many folks coming through may not have had every amount of respect that they might deserve, as they're folks who are experiencing an illness, a disorder, a medical condition. And just like any other medical condition that needs treatment, we need, and they deserve the treatment from all of respect from all of us. And when they come into our different services, we want our staff and everybody that interacts with them to have sort of an extra sensitivity to the process and say, thank you for having the courage to go to the fire station and begin your journey of recovery. And thank you for allowing us to be part of that journey. And while you're on the journey, we want you to know that we have a number of very significant resources that could be available to you if you wish. First, we know that people have setbacks, and we have a state-wide addiction crisis line that people can call, and soon we hope to be able to go wherever people are as they may have a setback and be with them and help get them back on the pathway of recovery. We know that people have their families and their loved ones in their life have a tremendous amount of stress as this process goes forward. We want people to know that we have resources and specialists that can work with their family if they just give us the word. And last, I'll just say that we know that the journey of recovery often interrupts somebody's dreams and hopes about what it is that they might want to be doing in their life. Maybe they wanted to go and complete school, or they had a particular avocation in mind. And we want to be able to tell them too that we have specialists that can work with them, and we have a list of employers who are friendly to people who are on the journey of recovery that will keep it going forward. So those are a few of the things that the messaging is very important to people, and we're working at trying to make sure that people that have been successful can convey that to people that are just starting through the process. So I just want to thank all of you for coming and being willing to speak tonight, and all of you for, and we're all going to learn together. So thank you, and I'm looking forward to tonight's program. And now I have the job of introducing an amazing person who has worked so very hard night and day in this issue, and trying to make sure that all the pieces come together, and that 6 drivers are able to go to the different fire stations, and and that the shelter and all the things that people might need to be successful in this effort. Scott Slattery, who is the director of our housing programs. So thank you, Scott.
Good evening, everyone. Thank you again for coming. Thank you, Mr. Mayor, again for your leadership. Huge thanks to Brian and the firefighters and our folks at AMR and the folks at the hospital. As everyone said, this is a true community partnership that could not have been pulled off without this type of involvement. As everyone sees, there's a lot of moving parts with Safe Station. And I have the pleasure tonight of introducing some of the other speakers tonight and kind of acting as a little bit of an MC. I'm just going to tell you a little bit about how it works. And as I said, there's a lot of people and a lot of moving parts, but we break it down to almost a simplistic approach from our Maple Street and the staff that work for me. We welcome folks to come. We thank you for taking that first step, that hardest step of coming into the fire station. We connect with services. As many services and the most appropriate services that we can for people. And we support throughout the journey. As Peter said, there are many stumbling blocks in the recovery journey. We want to be there. We want to be those people that are going to, turn to look for the Angelas and Sean's and the folks up here on this panel that are doing this day and night. So Peter's right, the mayor's right, 24 hours a day, 7 days a week. Trust me, I know, my phone goes off at 3:30 in the morning because someone's walked into the fire station. And you know what? As I get my bleary self out of bed and say, oh, I remember, and then I remember why I'm doing this. And why am I doing this? Because this is my community, and I want to help in our community. I've been working for Peter at Harbor Homes for a very long time. We've never taken an initiative like this before. Taking something and building it from where we are. And I like to think we have a pretty successful program. So yeah, anytime, day or night, 24 hours a day. In addition to my phone going off, there's a gentleman in the back row, back over there, and I'd really like to recognize him. His name is Paul Gowell. Paul's one of Paul and Herv are our 24-hour-a-day on-call drivers. Paul's been to every fire station in the city every day of the week, every night, every time of the night. A smile on his face, a hello for you, a welcome. Thank you for coming. So I thank you, Paul. I thank you for everything that you do, and I wish Herb was here because I'd say the same thing. But it's not just Paul and Herb. It's the staff at the Maple Street facility, our Maple Street Safe Station. So you get picked up, you go to the fire station. Chris's folks from AMR come and do a medical clearance on you. They'll take some vital signs, make sure, do you need to go to the hospital? Or are you ready to start the next step in that journey? If they're ready for that next step in the journey, that's where Paul steps in, I step in, Herb steps in, and we transport, and we go to our Maple Street Safe Station. It's also where the shelter is located and various other programs as well. Immediately, that person is connected with the 24-hour-a-day on-call licensed alcohol and drug abuse counselor. 3:30 in the morning, this person can get an evaluation by a licensed person. If it's the middle of the night or it's after hours, they stay with us at Maple Street. They stay with Sean and the staff and Julie and other of my Maple Street staff that I see here today. They keep them safe till the clinic opens up, till the behavioral health, the other counselors and folks come in during the day. They get transported from Maple Street to this building. They get connected. It's always a warm handoff. No one's just dropped off. No one's just, okay, take care kind of thing. It's a warm handoff from Sean to Jamie to Angela to all these people. It's about respect and it's about dignity. Then it's taken over by the professionals, those licensed alcohol and drug abuse counselors, the licensed therapists, the doctors and things like that, to determine what's the next step in their plan. What's the next step in their recovery? What's the next step? And I apologize, I have my back folks over here. I don't like this pole right here. They take over from there and they determine what's the best choices. Is it an outpatient program? Does a person need a residential program? Does the person need a partial hospitalization program? Housing is always an issue that comes. Is a person homeless? Is a person not safe where they're residing? Is it not a good environment for them to go back in? Are they at risk for relapse in their recovery journey? So they're never alone throughout this journey. From there, we continue to work with them along. We want to follow them through their journey. After they complete their program, it's over. We want to know what happens 60 days later, 90 days later, 120 days later. How are you with your recovery? Peter, through his leadership, has got a whole team of people working and keeping in touch with folks to find out where folks are in that recovery, because that's a critical piece. We've had some folks come to the fire station 5, 6 times. Can it get frustrating? Sure. But you know what? That 6th time might be the time. And that's what I say to the staff over there. Yeah, I know Scott's been back to the fire station several times, but you know what? Scott might need 5 or 6 times. We know that one visit to the fire station doesn't cure someone's, substance use disorder. So it's an ongoing thing. But if I like to just leave anything with on how our process works and how we see it, we welcome, we connect, we support. And we'll continue to do that all along. I don't want to take too much time. I want to hear from other folks, and I want to hear from the folks tonight and answer your questions. But I do want to take a minute. It is absolutely my pleasure to introduce John McAllister, who's a Nashua firefighter, who wants to tell us a little bit about his perspectives from things at the firehouse. So.
Good evening. Anyways, I'm just going to give you a brief synopsis as far as what takes place when they come to the firehouse and when the doorbell rings. So, as Scott has mentioned, and everybody's mentioned tonight. Okay,
There you go. Okay.
All right. So I'll figure this out before the end of the night. But as everybody's mentioned tonight, 24 hours a day, 365 days a year, 7 days a week, the doors are always open, and that's the way it's always been with the firehouse. You ring the doorbell at a firehouse, we'll answer the door and we'll help you out. Put air in little kids' tires numerous times. It doesn't matter. So when this whole program started in Manchester, it was different. It was different for everybody. But working with Manchester, we figured out the best angle for Nashua. Hats off to the chief. Assistant Chief Rhodes did a fantastic job working with AMR and the mayor in making sure that this worked for Nashua. And thanks to Peter Kelleher, it worked because we had Harbor Homes and Keystone. We have much more room to place people than they do in Manchester, so we're fortunate in that aspect. So when the doorbell rings, the firefighters will get up and we'll go over and answer the door. This person looking for help, as everybody said, they've seen it. they've seen, I guess, the light. I don't know how to explain it, but they've said, this is the day that I want to get help. So they come and they knock on the door. We introduce ourselves, welcome them in. Ask them a few questions right off the bat. They sit down, and then we started a quick vital signs, and we take their blood pressure, their O2 stat, their pulse, their temperature, and just kind of get a general consensus of this person. If they haven't used a drug or alcohol in the last 2 hours, then that's one of the things that we look for, and we say that they're clear to go on to the next step. So we go through the process, we take down some information. While we're there, the officer in charge will call Harbor Homes and start the process. They'll call fire alarm, put us out of service for, as they've said, it's been about less than 15 minutes on an average. But while we're there, a lot of things transpire, because now we've done our job as far as checking off and making sure that this person's capable to go to the next step. So this person's here, and he or she is finally seeing that they want to get help. And they start talking to our members. They start opening up, and we've realized in the short time that we've been doing this that we are a counselor for these people, and they're telling us, a lot of times they're telling us why they got started, how they got started, who they use with, where they're living. I mean, there's a lot of information that comes out. So that was different for our members. That's not something that we deal with on a regular basis, because we go to these calls. And as the mayor had said earlier, we've been going to heroin overdoses for years, many years, even long before this was the epidemic that it is. We've been going to heroin overdoses and dealing with this. So we never talked to the people once they came out of the overdose. So now just because we get them under the ambulance, they go to the hospital, and then we move on to the next call. Here we have about 15 minutes that we're actually talking to this person, and they're actually telling us and telling us a lot of information that is personal information to these people. So our members sit down and we talk with them, and we just kind of give them an idea of what's going to transpire from the next step once Paul comes and picks them up. Or Herv, and and then AMR will show up. AMR will again go over all of the vital signs to make sure that this person is not a hazard to themselves or anybody else, and make sure that they go on to the next step. And that pretty much sums up what we do at the first step of the person's journey. We taking questions now, or are we just moving on? Or
John, we're going to move on, and we'll take questions at the end of the panel. So, but thank you, John. I appreciate that. So as John said, when someone gets to the fire station and picks someone up, and Paul or one of the drivers or myself gets over to pick them up, the first place, typically, if it's an after-hours thing, our stop is our Maple Street Safe Station. And they get to meet some amazing people that work there. 24 hours a day, 365 days a year, snow, rain. I mean, yes, just like the mailman. We have a handful of folks here today from the Maple Street, but I really wanted folks to hear from one of our overnight person who's there in the middle of the night when people are having some of those most difficult challenges in what they do. So it's my pleasure to introduce Sean Sheehan from the Maple Street Safe Station.
It was very interesting adding on to what John said before I get started. We are counseling. We try to continue that flow from the fire station, that welcoming feeling, till they get to us. They're, like John said, about 15 minutes they're at the fire station before they're transported. We typically have them about 45 minutes to an hour. And I can only tell you the stories that I've heard, the people, families that have came in and brought their children in, and all that. It's amazing what we've heard. I think we've all heard it. And they really just want to talk. You're right, John. Mm-hmm. We spend some time with them. I'm just going to go, Scott kind of hit our program high level on what happens when we get a call. When we get a call at Maple Street, it's a gateway evaluation. I've heard that a million times, and it's great. We'll immediately dispatch a drive. So the fire station will say, hey, Sean, John, 27-year-old male, needs a gateway evaluation. The nice part is that all the drivers also use the Nashua City text alert system, so they get it too. But we still call them, they go out and meet the fire station, whatever it is. It's actually 6 fire stations and fire alarms, so it's 7 places that they could possibly go. And we get, East Hollis, that's the biggie. That's where we see most of the people come from. Once that comes, Paul or Herb will go down and pick them up, and they will come to Maple Street. We have a very short questions because we want them to be comfortable. We want them to feel like the light's on them, and we're going to ask them a million questions. Name, drug of choice, date of birth, etc. When do you last use? Immediately after that occurs, this is after hours, just so everybody knows. During the regular business day, they transport immediately from the fire station to this building to connect to services. But after hours, we will go through and do like Scott had said, we will contact the crisis line, who will contact the on-call LADAC. Alex this week, because we've talked. They will do an assessment. This is where it really is key. That assessment's definitely not clinical. That's Jamie's area. But it's really like Alex called, it'll be significant, the LADAC evaluation over the phone. And all the LADACs will say, give Sean or give Julie or give someone about, what do you see? And that kind of puts everything together, Most of these people want help badly. You always, a couple of them you want to talk, I want to leave. Do you really? A lot of it is it's a counseling thing. We want them to stay. We want them to get safe. If for some reason they are not medically respite eligible, they will stay with us at Maple Street overnight until the next day when they can get together with Jamie. Angela does a great job in respite. So I think, Scott, we've always said we're kind of like a hold station. Temporary hold, short-term hold, to either get them to respite or back over here the day. We have double staff on 24 hours a day. As Scott had said, we are part of there is the shelter with us. But it was very interesting when John had started saying that it's a continuum. We want to make sure they're comfortable. And we've done a lot of, we've all done some arm bending. No, you want to stay. It's amazing what Gatorade and Hot Pockets can do. I can tell you that. I've never seen so many Hot Pockets and Gatorade in my life. But it works. And that's the key. Because a lot of times, either they haven't eaten, they haven't had anything to drink, and unfortunately, sometimes they have to go over to the hospital to get checked up. But as Dr. Roseman said, we get calls at 4 in the morning. They might have went in at 10 o'clock to the fire station, and at 4 in the morning, they're medically cleared by the ER. I have to talk to Paul and Herb at 4 in the morning. They come out and get them. So it's all about keeping people comfortable, and it works. Treat them like a person, don't treat them like an addict. And the success rates are huge. So that's basically what we do at Maple Street.
Thank you, Sean. It's not just what you guys do at Maple Street. It's critical. It's the critical first step in that recovery journey through our safe stations. Right now, I have the absolute pleasure of introducing Angela Sweeney, who's one of our medical professionals here at the Harbor Care Health and Wellness Center. Angela works with folks with substance use disorder in both the clinic environment as well as our respite environment, but I would prefer to let her tell you a little bit more about that. Angela Sweeney, folks.
Thanks, Scott. So my name's Angela. I'm a nurse, first and foremost, but I'm also the nurse manager for the Respite Center and the director of clinical administration for the Harbor Care Health and Wellness Center. And I work about every other weekend, one day, in the Respite Center to keep in touch with the day-to-day, minute-to-minute operations. So we get the call from usually the on-call LADAC, Alex this week, like Sean said. And she says, she gives us a report of what the patient is coming in for. Health history, brief health history, their drug of choice, and if we have a bed, we take them. And once they arrive at Respite, there's a nurse and a medical assistant 24 hours a day. And they greet them and take them to where they're going to be staying. There's 11 beds in the Respite unit. And from there, we help them fill out paperwork. A lot of times they're not in a state of mind where they can fill it out on their own, so we help them if it's needed. We go through their belongings with them. Sometimes they come in with drugs that they have left over or things that they use, so we have to take those from them. We don't hold that against them, we just take care of it. And from then, we make them comfortable. The nurse does a head-to-toe assessment on them, gets their vital signs, whatever they are detoxing from. If it's alcohol, we use a CWA scale, and it's basically a series of questions and assessments that gets us to collect some data on what kind of medications they need. For alcohol withdrawal, we use Ativan to help assist them in their withdrawal. And if they're withdrawing off of opiates, which is mostly what we see, we use a COWS assessment. And based on the score of that, depends on the meds that they get. So we don't use any replacement therapies for withdrawal. Like some withdrawal places will use methadone or Suboxone to help, and we don't use any of those. We just use muscle relaxers, ibuprofen, things like that, just to help. And sometimes we'll get patients that are also taking, say, a benzodiazepine, and in that case, we usually call the on-call provider. Dr. Sylvia is usually the one that we call, sometimes at 3 in the morning, and let her know that they're going to be withdrawing off of benzodiazepines also, and we need to taper them down because of the risk of seizures. So we'll do that. We also have an agitation scale that we use. Once the patients start detoxing, they can become agitated, and we keep an eye on that scale to see what we need to do, and we take it from there. The average stay for a respite patient is about 7 to 10 days. Sometimes we'll get someone in for 24 hours and withdrawals start kicking in and they leave, unfortunately. Like Sean said, we try to get them to stay, but we don't force them to stay. They are welcome to leave if they want to, but we definitely do our best to get them to stay. And some patients end up staying for 3 weeks. We have a couple different programs that we help them get into. So a licensed alcohol and drug counselor sees them once they're down in respite and comes up with a plan. So we'll come up with a residential, say one patient needs residential or they need PHP, which is the partial hospitalization program, which is right in this building. IOP, intensive outpatient program, and that's Jamie and Roxy. And it depends on their use and their history and the substance that they're using, that they base on what program they send them to. And we will keep them until, say they can get a 28-day residential bed in 2 weeks. We'll keep them until that day comes. A lot of times the patients are homeless or they're living with someone that is using. So it's not safe for them to leave, and we're more than happy to keep them safe until they can get into further treatment. We get a lot of patients that haven't had health care in a long time. They don't have insurance. They don't have a primary care provider. They're not on the medications that they should be. So we connect them to all those services. We usually, first and foremost, we have them meet with a navigator, who one of them is here tonight. Her name's Lori. And she applies for insurance with them. And if they have depression, PTSD, anxiety. There's a lot of undiagnosed mental health disorders that go along with their substance use. So we get them connected with behavioral health services and medications if needed, which helps them stay clean. If they have a depression, you know, they're using to mask and, you know, make those symptoms go away. So it really helps assist in their treatment. I think that's pretty much, I mean, you know, it's 24 hours. The nurses care so much about these patients, you know, they're counselors a lot sometimes too, and we're more than happy to have conversations with them about what they're struggling with, their plans. A lot of them have a lot of conflicts personally with, you know, whatever relationship they're in, and we just talk to them and treat them like human beings. A lot of the patients have had very bad experiences in healthcare because of their substance use disorder. They're not treated fairly, and we try to change that stigma and make them feel comfortable. So I think that's about it. That's all I wanted to cover. Thanks, Scott.
Thank you, Angela. We're gonna leave plenty of time at the end for questions and things, because I'm sure folks may have questions for Angela along the way. I'd like to take a minute to introduce Jamie Gormley, who's one of our licensed alcohol and drug abuse counselors, sometimes that on-call person in the middle of the night that gets those calls. But again, is that next connection throughout the process, working with Annette and the folks over at Keystone Hall. They're that next piece of this journey. So this will be my last. I'm going to have Jamie take over the MC duties after she finishes speaking, but we'd love to have some quick Q&A at the end. But folks, welcome Jamie Gormley.
Thanks, Scott. So like Scott said, I am the coordinator of outpatient services at Keystone Hall. So we get to see all of the clients that have come through Safe Station. They've all made their way through our halls one way or another, either bright and early in the morning when we open. We might have people that have gotten dropped off at 8 o'clock. We open at 8. They're usually here by 8:30, and they've come to the shelter in the middle of the night, and we've gotten those calls in the middle of the night. And so we do really have warm handoffs. They sit right in the lobby with Bridget or Carmen. They call us. We come right down. We grab them. We have 6 LADACs and a CRSW on staff that assesses. And we do a pretty thorough assessment. We have strict kind of guidelines based on ASAM criteria that we go by, which really determines the level of care that's most appropriate for anyone. So I know everybody kind of touched on it. We get a lot of people who aren't feeling very well. And in that case, if they're in intense detox symptoms, they're withdrawing, we make that referral to Angela. And it really is as simple as we write up our paperwork, we make our case and why we feel like they meet criteria to go to medical respite, and we walk them downstairs and we say, hey, Sue, hey, Angela, we have this mail. We call first to make sure that they're ready. But we walk them right downstairs and we say, this is Sean. Sean's here. He's ready. This is what's going on with him. And they take it right from there. Different people have different level of care needs. So we're lucky because we have so many services at our fingertips. So we have medical respite at our fingertips. Keystone Hall is our residential facility at 615 Amherst Street. And we all of the LADACs upstairs, I mean, we meet regularly. We talk regularly with Charlotte and Jess, who are our intake coordinators. So it's simple. We literally put it in our machine and scan it over to them, and they're on our list. It's really that easy for us. And we're lucky that it's that easy for us. If the client needs outpatient services, we can do an intake right there. We intake them, and once that intake's done, they can start whatever outpatient services that they need, whether it be IOP, relapse prevention, men in recovery, women in recovery. We have lots of groups that they can pick from, or one-on-one. If PHP is if they have higher needs than IOP, but maybe they don't meet criteria to go to residential treatment. We have a great relationship with Jen and Ivy at PHP. They are literally around the corner down the hall from us. And we call them and we walk the client over and they get an intake for PHP. It's crazy how easy it is for us. Let me think, if a client is homeless, we have the ability to connect them with people who work on housing. We have one of Open Doors, which is a program that we have that works with pregnant and parenting women with a substance use disorder. We refer back to Sean to help us. We really do have a great team that encompasses everything they might need. Did I miss anything? I think everybody kind of touched on everything that we do. But like Scott said, I'm going to take over MC duties. And I think the best part of our panel tonight is the two people sitting over here. Oh, sorry, not you, Sean. Sorry.
We do get along great, don't we?
We have two clients that have graciously volunteered to talk about their experiences. They've been through safe stations, and we're so excited that they're here because they've lived it, and this is the best experience that we can get right here. So we have Brian and Tyler, and I am going to give it to you, Brian, to tell me about your experience.
All right, Brian.
I'm Brian, and I'm a grateful addict in recovery. And my sobriety date is January 26th, 2017. My dad had brought me to the safe station on the top of Main Street, Amherst Street, and my life changed immediately. My dad rang the buzzer. He's like, "Can you help my son?" Immediately, 6 or 7 firefighters came to my aid. I was crying. Didn't really feel well. I was immediately in detox. And I felt a relief when they came to my aid. I felt like a new person almost. And I didn't really feel that pain in that detox. I just felt relief. And I'm very grateful to be here today, because if it wasn't for the Safe Station or Harbor Homes or Keystone, I probably wouldn't be here speaking today. And I'm very grateful. I've changed my way of life today and a better outcome of my future. It's just been so real. I showed up there at the safe station, and they immediately took my vital signs, open hands. I even hugged all the firefighters because I didn't know what to do. I was scared. And they immediately took my blood pressure. They asked me what I was using. I was using heroin. And it was really tough for me. I thought I was going to get arrested because I had all my stuff on me. I was like, am I going to get arrested? They're like, no. And I'm like, okay, good. So I felt relieved. And my dad, the look on his face, because he brought me there, and it was just the faith in his eyes, just like, was finally, he got it. Because he always told me about the safe station. I never wanted to listen. I was always scared to ask for help. I was really scared to ask for help. And I didn't want to go through the detox again, because this is my second time doing this. And the first time I thought, 28 days, you're over. No. My sobriety continues forever. Because if I go back out there, this is my last chance. So I showed up at the safe station. It was about 11 o'clock in the morning. Immediately, 10 minutes after they took my vital signs, 2 gentlemen picked me up in a pickup truck. And my dad was like, "It's all right, Brian. These guys are going to help you out." And I felt safe. I really did. I'm like, I'm finally doing this. This is great. They took me to Harbor Homes, and that's where I met Roxy. My dad, I was very, very sick. I was shaking. I was throwing up in the bathroom. Roxy was helping my dad to fill out the application as quick as possible because I was going through immediate detox. And I know how that feels because I've done it in jail, and it's not fun, but it's a lot easier here than jail, I'll tell you that. Completely helped me out. Roxy was very helpful, trying to calm my dad down, calm me down. And we got through the paperwork, and she was right there telling me everything was going to be okay. And I trusted her. I really did. And like they say, these doors are always unlocked. You can leave whenever you want, but I knew I couldn't leave here. I didn't want to leave here because I really felt like I was wanted. I didn't get pushed away. I didn't get talked down on just because I was an addict, you know? And that felt really comforting. It's really comfortable to know that people really care about addicts today. And this program is amazing. And Roxy led me downstairs to where the 11 beds are, and Roxy said, everything's going to be okay. We'll check up on you. And I was going through rough times down there, but they gave me muscle relaxers and clotidine to help with the detox. And it was rough sleeping at night, but I knew what I had to do to get through this. It was only a week. I was down there for a week, and Roxy really pushed me through to get me to the next level. And she was always coming to check up on me. The nurses are here amazing. It's like they're all moms to me. Like, they always, like, every time I come here for appointments, I see them, they're like, Brian, you look so good. I gained 60 pounds in 2 months. That's a pound a day. I'm 91 days clean today. And this is the longest sobriety I've had in 18 years. My life became unmanageable when I was the age of 15, just started with weed, and weed can lead up to different drugs, and it has. And when I left the respite center here, I was informed that I was going to Keystone. I was scared. Never been to Keystone before, so I didn't know what the outcome was going to be. So Roxy said everything's going to be okay. You'll do fine. You'll see people that you probably know there. And John came to come pick me up from Keystone, and I felt welcomed right away. He's like, "You want to smoke a cigarette? Go ahead." I'm like, "Yeah, it's been down here a week." So I did that, and then I was on my way to my new life. My new life was beginning. I finished the 28-day program at Keystone. I wanted to further my recovery. Keystone, the staff and everybody are amazing. The food is great. The staff is great. They feed you really well. And they're just, it's so opening. Like, I don't even want to leave. Like, I love it there. And these people grow on you, and we grow on them too. And it's just like they have activities for us. They give us smoke breaks, and some people don't, you know, and they really care about you and your well-being. It's really clean there, and they give us chores to do every week just to keep us busy. I'm always volunteering, and if it wasn't for all these people, more than I can name, then I wouldn't be here today. And like, I'm just so proud to represent and be up here and speak today and share my experience, because it's real, and I feel way better than I had 3 months ago. And I believe in myself. I believe in the program, and it's awesome. Like, Alex is always there for me at Keystone. She always gives me a smile. I ask her how she's doing all the time in the hallways, and she sees a brighter person in me. Like, I weighed 160 when I first went there. I weigh 225 now. That's a healthy Brian, and I love it. I try to keep myself busy. I go to meetings every day. I try to every night, and with the meetings and the program there, they teach you about the tools you can use in the future. I haven't filled up that tool belt yet, but I have. It's pretty much full, and I have the tools to go out there that will cause triggers. I know what to do. I'm always around when I'm downtown by myself. I always have a meeting that I'm around, because they tell you this. They tell you what you can do, what you can expect. And now I'm in the 3-month program. I am very grateful to be in the 3-month program. I get to go out, and they trust me out there, and I trust myself. And that's a big part, because Nashua is where I was doing my thing. And today I care about my kids, I care about Keystone, I care about my family, and it's tremendous of how much hurt I put out there, but I'm so willing to rebuild those bridges today with this program. And the thing is my dad went back once he drove me followed me here. He went back to the firehouse and thanked every one of those firefighters and said, my son's my hero, thank you for saving his life. And whenever I hear that from my dad, like, I can go out there and do activities with him today. Like, I can go out and celebrate his birthday, and we can go bowling, and I used to never be able to do that. I would always have to do that. And I'm grateful that I can go to sleep at night and wake up with a bright outlook, and where I'm living right now, I love it. I completely do. It's sad to see people go. I'm always curious of how they're doing. Some don't make it and some do, and it's real, because this addiction wants us dead, and it's not going to kill me though. I've already been there. I've hit rock bottom, and I can't go back to that place. So, and I won't. But I signed up for the 6-month program. I'm really grateful for Keystone, like I said, and my discharge date is June 2nd. But I'm looking at Rise Above and the Gatehouse to further my sobriety, because I'm never done. I don't want to be done, because I never want to go back. And I can't thank Nashua and the state of New Hampshire for these programs that have given me another chance at life, because like I said, I want to be back with my kids one day. I can send them money today that I haven't been able to do in a long time. They actually got it yesterday for their birthday. I sent them $200, and if I had that money in my pocket 3 months ago, I would have been down, and I'm just glad I can hold on to money and buy things I need today. And I share, and I give to other people. That's the Brian that people expect. And it really feels good, and I just can't thank them enough. And if I left anybody out, I'm sorry, but I really do thank everybody that's helped me out, Keystone, Harbor Homes, and the Safe Station, because it all started at the Safe Station, but I'm glad for these other programs too. And that's my experience, and I'm very grateful to be here today. Thank you very much.
I told you that would be the best part of today. Thank you, Brian. Thank you for your words. We have Tyler also, who's going to talk about his experience.
Hi, my name's Tyler. Grateful recovering addict. Just want to share my experience, strength, and hope. Try to keep it short. It's kind of a long story. Been struggling for 15 years. For the last, I got here in Nashua. I'm from Western New York. I got in Nashua last year in March, and I've been back and forth struggling with this and trying to get back on top. I went back home last year, or at the end of last year, and I ended up overdosing twice. And so I just want to thank all you first responders. Without you guys, I would not be here, and that is a fact. So I just want to say thank you to you. And when I got here, I came in, I went to the fire station. Like everybody said, you guys treat me like a human being. You don't look down your nose. You talk to me in such a kind way. It was very warm and welcoming. I appreciate it, and thank you. You know, I got to the Maple Street, and then they got me down over here to the Respite. It was very quick. I didn't have to wait. I had to wait at the Respite for 2 weeks to get into Keystone. While I was at the Respite, I talked with the nurses like they were my counselor. It was very nice. They helped me get through a lot of my emotions that I was trying to express to myself because I've been burying it deep down for years. I didn't even know how to feel. So, and then after that, I went to Keystone. I was there. I did the 28-day program. While I was there, I worked very hard to find an aftercare program. I spent about 3 weeks working on that because there's a waiting list at every place for aftercare. But for me, that's the huge part. You know, it's what solidifies the foundation for me in my recovery. It gives me a hope for a future. And I just have to say, you know, special thanks to Roxy for getting me to Keystone and everybody all these working parts. I can't thank you enough. Everybody at Keystone, they really taught me a lot of things while I was there. And now I'm actually in a transitional living out in Hancock. It's a new place called the Addiction Recovery Coalition. It's a wonderful program. It's me and my 3 roommates. We live there, and they are actually all safe station success stories as well. You know, but they all went through Manchester. Yeah, so I mean, it's a beautiful thing to see. To see it work, to see you guys see the good win. You know, for once, it's a beautiful thing, and I can't thank you guys enough. With that, I'll just say goodbye.
Brian and Tyler, we can't thank you enough. I mean, Jamie's absolutely right. This is what this is all about. Both you said it. This is real. This is here. So thank you.
It always
Really
gets
appreciate
better.
that stuff.